Good evening, Prof. Nasser and classmates. Tonight, we, Henny Landayan and Annalyn Umali, are going to present the medical geography. Medical geography, also known as health geography or geographical epidemiology, is a subfield of geography that focuses on the spatial distribution of health and disease. It is an interdisciplinary field that combines elements of geography and epidemiology, public health, and social sciences to study the spatial distribution of health-related phenomena. Dissecting medical geography. Number 1. Geography is the holistic study of how different factors affect the physical and human components of the surface. While number 2, epidemiology is a branch of medicine concerned with the spread of infection in a defined population. Infection is the replication of organisms in host tissue, which may cause disease. A carrier is an individual with no overt disease who harbors infectious organisms. An interaction of a carrier with other people can cause the spread of disease, but the study of medicine is limited that not enough to predict the behavior of a carrier. And lastly, number 3, the behavior of a carrier is aptly predicted by the combination of public health and social sciences. Social sciences refer to the study of the human behavior, and public health uses the social sciences in order to make accurate measures to ensure the safety and cleanliness in an area to deter the spread of disease. These three disciplines work together and are the tenets of medical geography. Medical geography examines the relationship between geographic factors and various aspects of human health, including disease patterns, healthcare access, and the social and environmental determinants of health. Historical development. The roots of medical geography can be traced back to the early work of John Snow in the 19th century, who used spatial analysis to investigate the cholera outbreak in London. Since then, the field has evolved significantly. John Snow is a renowned figure in the history of medical geography and epidemiology. He is often considered one of the pioneers in the application of geographical methods to public health and is best known for his work in understanding and combating the cholera outbreak in 19th century London. His work laid the foundation for the development of medical geography as a distinct field. John Snow's background. John Snow was born on March 15, 1813 in New York, England. He came from a working-class family and received his education through apprenticeship and practical experience. He trained as a surgeon and later became a physician practicing in London. Cholera outbreak and Broad Street pump. In the mid-19th century, London experienced several severe cholera epidemics. What is a cholera? Cholera is a waterborne disease that causes severe dehydration and can be fatal if left untreated. In 1854, during one of these outbreaks, Snow made a significant breakthrough by mapping and analyzing the cases of cholera in the Soho district of London. Snow's map showed a cluster of cholera cases centered around a specific water pump on Broad Street, now Broadwick Street. He noticed that people who drank water from that pump were more likely to contract cholera. John Snow and medical geography. Snow's analysis challenged the prevailing miasmatic theory of disease, which held that diseases like cholera were spread through bad air. Instead, he argued that contaminated water was the source of the cholera outbreak. Removal of the pump handle. Snow's findings led to the local authorities taking action. On September 8, 1854, the handle of the Broad Street pump was removed, preventing people from drawing water from it. With the removal of the pump handle, the outbreak subsided. This was a pivotal moment in the history of epidemiology and public health. Snow's legacy in medical geography. John Snow's work in mapping the cholera outbreak is often considered one of the earliest examples of disease mapping in medical geography. His approach of using spatial analysis and maps to identify disease clusters and trace their source laid the foundation for modern epidemiology and the development of geographical epidemiology. John Snow died 1858 at the age of 45, shortly after the Broad Street pump incident. His contributions to public health, epidemiology, and medical geography gained wider recognition in the years following his death. John Snow's pioneering work in mapping and analyzing the cholera outbreak in London remains a landmark achievement in the history of medicine and public health. His approach of using spatial analysis to understand disease patterns and transmission has had a profound and lasting impact on the field of medical geography and epidemiology. The key concepts in medical geography. The key concepts are not mutually exclusive, but the important ones are the following: spatial patterns, healthcare access, ecological determinants, social determinants, disease mapping, healthcare planning, and environmental health. Spatial patterns. Medical geographers analyze the spatial distribution of diseases and health outcomes, seeking patterns and variation across regions. Spatial patterns are observed through a combination of scientific inquiry and empirical observation. Using the previous John Snow example, it was clear that the water pump and the distribution of the water line supply across the spatial area caused the disease. Healthcare access. Understanding how geographic factors impact access to healthcare services is a crucial aspect of medical geography. In the John Snow example, it is important to note that the cholera outbreak happened in the Soho district of the UK. The Soho region is known to be more of a commercial type of area, with it being more of a shopping district than a community district with an accessible hospital. In the Philippines, a considerable Soho district might be Makati City, BGC, or Binondo. When disease popped out in the Soho district, it was difficult for the merchants to close down shop because of the loss of revenue. But at the same time, the increasing sickness toll among citizens could be bad for business. Healthcare access is considered more difficult for rural areas, areas without roads, or areas without electricity. Applying transport geography, accessibility is the measure of the capacity of a location to be reached from, or to be reached by, different locations. Therefore, the capacity and arrangement of transport infrastructure are key elements in the determination of accessibility. It is also noted that healthcare access for developing countries or global south countries is more difficult than you live in the US, the UK, or Canada. Not only is the lack of accessibility physical, but it could also be a financial form of inaccessibility. It is commonly harder for city residing low-income families to seek medical care or advice than high-income ones. Hypothetically, low-income families residing in cities as urban minimum wage workers still cannot visit a doctor if they feel ill, even if they are closer to the hospitals because of their inability to take a leave from their job or their lack of money to pay for the consultation fee or laboratory tests. These can hinder them from being healthy. Ecological determinants. Researchers examine how environmental factors such as climate, pollution, and land use influence health outcomes. Climate change has made the planet conducive to diseases of all sorts. Milder winters, warmer summers, and fewer days of frost make it easier for these and other infectious diseases to expand into new geographic areas and infect more people. As of recent times, when some blocks of ice in Russia and Antarctica melted, some frozen virus genes also defrosted and thrived in our current warming environment. This is not to say that the human race is now vulnerable, as there is a discouraged concept of environment determinism. Environmental determinism is the doctrine that human growth, development, and activities are controlled by the physical environment. This aspect has long been disproven in the latest studies of human geography. However, the risk still increases, and it is up to the human ingenuity to improve the living conditions in order to ensure that ecological determinants provide positive health outcomes. Social determinants. Social factors like income, education, and cultural practices are considered in relation to health disparities. Applying the lesson on John Snow, he was from a middle-income family and received practical training. He was more attuned to his surroundings and scouted the area in order to understand the cultural practices on the Soho district, where the cholera outbreak thrived. Preventing people to drink from the water pump in the Soho district is considered a new cultural practice as it teaches the population in that area to revise a bit of their lifestyle to prevent the spread of disease. Disease mapping. Mapping the distribution of diseases is fundamental to understanding disease epidemiology. Geographic Information System, or GIS, and spatial analysis tools are used to create disease maps. John Snow manually walked the street with his boots and noted the address and whereabouts of the individuals infected with the cholera. After mapping the area, he listed all the factors in that area that might have encompassed all the individuals. Since the theory of miasma, or bad air, and air was difficult to be tested, John Snow looked for concrete aspects to prevent the fear among the ailing population. Soon, the water pump was discovered as the common resource of all the sick people partook in. Therefore, the contagion with the cholera infection was discovered in the water supplied of that particular water pump. Before the computerized GIS tools, geographers were avid illustrators and users of the printing press. Although some of that strategy remains today, the system of mapping is only getting better. Healthcare planning. Medical geographers assist in the planning and allocation of healthcare resources based on population distribution and health needs. In the John Snow example, Snow's finding led to the local authorities taking action on September 8, 1854. The handle of the Broad Street pump was removed, preventing people from drawing water from it. With the removal of the pump handle, the outbreak subsided. This was a pivotal moment in the history of epidemiology and public health. In the Philippines, ideally, there is a functioning health center with a health officer and the doctor per barangay, according to the principles in the Local Government Code and Barangay Health Workers Benefits and Incentives Act of 1995. There are long lines realistically, and the LGE doctors might not even be available all the time in their outpost. As of current, Congress aims for better benefits for health workers to depoliticize the process of providing health services to the Filipino population. Environmental health. This field focuses on the impact of environmental factors on health, including the study of diseases like vector-borne illnesses, like for example malaria, Zika, and the effects of pollution. The disease is vector-borne when it is carried by mosquitoes, ticks, flies, and other vectors. COVID-19 is a short-range airborne disease, as we all know, in such a way that the virus can spread from an infected person's mouth or nose in a small liquid particles when they cough, sneeze, speak, sing, or breathe. Another person can then contract the virus when infectious particles that pass through the air are inhaled at short range. This is often called short-range aerosol or short-range airborne transmission. Or if infectious particles come into direct contact with the eyes, nose, or mouth, that is a droplet transmission. Data and methods for medical geography. Geographic Information Systems, or GIS. GIS technology is fundamental for mapping and analyzing health-related data on spatial scales. Spatial analysis. This includes techniques like spatial autocorrelations, hotspot analysis, and spatial regression to uncover patterns and associations. Remote sensing. The use of satellite and aerial imagery is important in assessing environmental factors. And lastly, the qualitative methods. Interviews, surveys, and ethnographic research are employed to understand the social and cultural aspects of health in specific regions. None of these were present during John Snow's time. He used manual mapping. He carried a map of the area and made symbols to signify the infected people. There was no specific questionnaire or form of interview. It was pretty informal. The conclusion. Medical geography is a dynamic and evolving field that plays a vital role in understanding and addressing various health-related challenges. It contributes to more effective healthcare planning, better disease prevention strategies, and the reduction of health disparities through a geographic lens. Thank you for listening and have a great night.